Take 30 seconds right now and look down at your own feet. Not a glance, a real look. Because what you notice in the next half a minute could matter more than almost anything else you do today. Here's why. There is a disease that can quietly damage your blood vessels for years, sometimes a full decade, before a single blood test ever flags it. And the very first place it usually shows itself isn't your heart, isn't your eyes, isn't your kidneys. It's your feet. Your feet are the farthest point from your heart. They sit at the very end of the road for your circulation, fed by the smallest, thinnest blood vessels in your entire body. So when something starts going wrong with those vessels, your feet are almost always the first to feel it. And sadly, the last place most people ever think to check. Today, we're going to walk through 9 specific things your feet may already be telling you. Most of them have nothing to do with simply getting older, even though that's exactly how most people explain them away. Stay with me through all 9 because the 5th sign is the one almost nobody connects to blood sugar at all. And the 9th is something you've probably looked at 1,000 times without ever understanding what it meant. Let's get into it. Here's something most people are never told in a routine checkup. The condition we're talking about today isn't really a sugar problem. At its core, it's a blood vessel problem. Think about it this way. Sugar itself isn't the villain sitting in a vault somewhere doing damage. The real damage happens when sugar stays elevated in the bloodstream for months and years at a time. That extra sugar behaves almost like a fine grit, slowly wearing down the delicate lining of your blood vessels, especially the smallest ones. And your body's smallest, most delicate vessels aren't hiding deep inside your chest or your brain. They're in your fingertips, your eyes, and your feet. Your feet sit at the very bottom of the circulatory system, the farthest possible distance from the heart's pumping action. When circulation starts to struggle anywhere in the body, the feet are usually the canaries in the coal mine. That's exactly why we're starting here and not with a blood test. Because your feet have been trying to talk to you for a while now. You just may not have known the language. Let's begin with sign number 1. Sign 1. Tingling or numbness. Almost everyone has felt this at some point in life. You sit cross-legged too long, your foot falls asleep, you stand up, and there's that brief pins and needles feeling. That kind of tingling is completely normal, and it has nothing to do with what we're discussing today. What I want you to notice is something different. Whether this tingling or numbness shows up on its own, for no clear reason, again and again. Sitting at the breakfast table, lying in bed at night, walking out to get the mail. If your feet are tingling on their own schedule, with nothing pressing on them and no reason for it, your nerves may be trying to tell you something. Here's the mechanism behind it. When blood sugar runs high for a long stretch of time, the extra glucose can slowly damage the protective coating that wraps around your nerve fibers. Picture an electrical wire with a rubber insulation around it. That insulation is what keeps the signal clean and accurate. Strip away even part of that coating, and the wire still carries a signal, but it becomes fuzzy, inconsistent, unpredictable. That fuzziness is exactly what tingling and numbness feel like in real life. Major diabetes organizations estimate that roughly half of people living with diabetes will eventually develop some degree of this nerve damage, often called peripheral neuropathy. And it tends to start in the feet before anywhere else in the body. Let me tell you about a man I'll call Harold. 69 years old, a retired postal worker from Michigan, the kind of man who still walked his old mail route for exercise every morning out of habit. Harold came in for an unrelated visit. Nothing to do with his feet at all. Almost as an afterthought, his daughter mentioned that his feet had felt kind of asleep for the better part of a year. Harold laughed it off the way most people do. "It's just my age, Doc." But that offhand comment was enough to make me dig deeper. One extra blood test that same afternoon told a very different story. Harold's blood sugar numbers showed he had likely been living with undiagnosed diabetes for at least 2 years, and his feet had been quietly trying to tell him the entire time. If this sounds familiar, if you've had tingling or numbness that comes and goes without explanation, here's what I'd encourage you to do starting today. Take a 20-minute walk every single day if you possibly can. Not a jog, just a steady walk. And start reducing added sugar in your diet now, not next month. Movement and lower sugar intake both help protect the nerves you still have. Sign 2. Burning at night. This next one is sneaky because it rarely bothers you during the day when you're distracted by life. It shows up at 11 o'clock at night, when the room is quiet and there's nothing left to think about except the heat radiating from the bottoms of your feet. Patients describe this burning sensation in all kinds of ways. Some say it feels like they walked barefoot across hot sand. Others describe a slow, dull heat that just won't quit, no matter how they shift position. When I hear a description like that from someone over 60, my attention sharpens immediately, because nighttime burning in the soles of the feet is one of the textbook early signs of diabetic nerve damage. Here's what's actually happening. The nerves in the feet have already sustained some damage and now they're misfiring, sending heat signals up to the brain even though nothing hot is actually touching the skin. It's a bit like a fire alarm with a broken sensor. The building isn't on fire, but the alarm keeps going off anyway, because the sensor itself has malfunctioned. Researchers who study diabetic nerve damage have found that this kind of nighttime burning pain can appear well before someone receives an official diabetes diagnosis, in some cases by a year or more. That's a meaningful head start if you know to pay attention to it. I think of a woman I'll call Patricia, a retired bookkeeper, lovely sense of humor, who told me she'd started keeping a frozen washcloth by her bed just to press against her feet at night. She'd been doing this for nearly 8 months before she ever mentioned it to anyone, assuming it was just one of those things that happens with age. It wasn't. If this is you, here's where to start. Drink water consistently throughout the day, aiming for at least 8 glasses, and add fiber to every single meal. Vegetables, oats, beans, lentils. Fiber slows down how quickly sugar enters your bloodstream after eating, which gives those already stressed nerves a little room to recover, rather than getting hit with sugar spikes over and over again. Sign 3. Wounds that won't close. This is the sign where things stop being merely uncomfortable and start becoming genuinely dangerous. Picture this scenario, because it plays out in clinics and emergency rooms constantly. Someone says, "Doctor, I had this little blister from a new pair of shoes about 3 weeks ago. It's still open. I figured it would heal on its own." And under normal circumstances, it absolutely should have. In a healthy body, a small cut or blister typically closes within 5 to 7 days. But when blood sugar runs consistently high, the tiny blood vessels that feed the skin of the feet begin to stiffen and narrow. The white blood cells, oxygen, and nutrients your body relies on to close a wound simply can't get where they're needed fast enough. It's a bit like trying to water a garden through a kinked hose. The water is there technically. It's just not reaching the soil that needs it. Here's a sobering, well-documented statistic from public health data on diabetes complications. Diabetic foot ulcers are consistently identified as the leading cause of non-traumatic lower limb amputations in the United States, with well over 100,000 cases occurring every year. And in the overwhelming majority of those cases, the story starts exactly the same way, as a small wound that got ignored for too long. I think often of a man named Eugene, a retired contractor who'd spent 40 years on job sites and considered himself tough as nails, in his words. A small cut on the bottom of his foot from a dropped nail had been there for almost 3 weeks before his wife insisted he get it looked at. By the time we saw it, it had already progressed further than it should have. The good news is that it was still treatable, but it never should have gotten that far in the first place. So here's your assignment for tonight. After your shower, sit down and look at both feet carefully, between the toes, underneath the heels, around the edges. If you find any cut, blister, or open spot, clean it gently with soap and water, apply a basic antibiotic ointment, and cover it. And if it isn't visibly improving within 48 hours, call your doctor. Not next week, 48 hours. Sign 4, skin discoloration on the lower legs. This one tends to hide in plain sight. You glance down at your ankles in the shower and notice they look a little darker than the rest of your leg, maybe a bit reddish, almost bruised, even though you haven't bumped anything. And the explanation most people give themselves is some version of, "I've always had darker skin around my ankles." Sometimes that's simply true and nothing to worry about, but there is a specific, recognizable pattern of discoloration that physicians are trained to look for, often referred to as diabetic dermopathy. When the small blood vessels in the lower legs are damaged by sustained high blood sugar, the skin in that area doesn't receive quite enough fresh oxygen-rich blood. Over time, that shows up as a change in color, darkening, a reddish-brown stain, sometimes patches that look faintly bluish. The skin in that area may also become thinner and more fragile, bruising more easily than it used to. Research on diabetic skin changes has found that these markers on the skin can sometimes be noticeable well before a formal diabetes diagnosis is made, in some cases over a year ahead of time. That's valuable advance notice, written quietly on your own skin. A retired librarian I'll call Dorothy once told me she'd assumed her darkened ankles were simply varicose veins running their course, something her mother had also dealt with. It turned out to be related, but not in the way she expected, and catching it opened the door to addressing the underlying cause rather than just the visible symptom. My recommendation here is simple and low effort. Spend 5 minutes each morning before your feet ever touch the floor, doing gentle ankle circles, toe raises, and calf stretches while you're still sitting on the edge of the bed. Even that small amount of movement helps push fresh blood down into the lower legs where it's needed most. Now, before we go any further, have you noticed even one of these first 4 signs in yourself or in someone you love? If the answer is yes, go ahead and type the word yes in the comments below. Just the word. I read every comment on this channel, and I genuinely want to know what people are noticing in their own bodies. Sign 5. Heels that crack and won't heal. This next one tends to surprise people more than any other sign on this list, because cracked heels are so common in general that almost nobody thinks twice about them. Here's the distinction that matters. Mild dryness in the winter, sure, that's ordinary. But when your heels are cracking deeply in the middle of summer, when no amount of lotion seems to make a difference no matter how often you apply it, that's a different story entirely. Diabetes can also affect a category of nerves called autonomic nerves. The nerves that quietly run automatic functions you never consciously think about, including the sweat glands in your feet that keep skin naturally moist from the inside out. When those nerves are damaged by long-term high blood sugar, that internal moisture pump essentially shuts off. No lotion applied from the outside can fully replace what the body used to do on its own. And those deep cracks aren't just a cosmetic nuisance. They function as open doorways for bacteria. In a foot where circulation is already compromised, even a minor bacterial infection can escalate seriously within days rather than weeks. Specialists who focus on diabetic foot care frequently point to stubborn, treatment-resistant heel cracking as a meaningful indicator of this kind of nerve involvement in older adults. Every night before bed, moisturize your feet thoroughly. I'll say that again because it matters. Every night before bed, moisturize your feet thoroughly. Coconut oil works well, but any good moisturizer will do the job. Apply it to the soles and heels, but avoid the spaces between your toes, since trapped moisture there can invite fungal infections instead. And keep drinking water consistently. Your skin needs hydration from the inside just as much as the outside. Sign 6. Persistent swelling. Some swelling in the feet and ankles is completely normal. Stand all day at a family gathering or sit through a long flight, and your ankles might puff up a bit by evening. That kind of swelling typically resolves overnight on its own. What we're talking about here is different. Swelling that shows up every single evening without fail. Swelling that leaves deep, lingering sock marks in the skin. Swelling that hasn't fully gone down by the time you wake up the next morning. When elevated blood sugar affects the kidneys over time, and diabetes remains one of the leading causes of kidney disease, the body's fluid regulation can get thrown off balance. Excess fluid tends to pool downward with gravity, settling in the lowest parts of the body, your ankles and feet. Here's a simple test you can try at home. Press a finger gently into a swollen ankle. Hold it there for about 5 seconds, then release. If the indentation lingers for several seconds before bouncing back, that's called pitting edema, and it's worth mentioning to your doctor at your next visit. Public health data on diabetic kidney disease suggests that it affects roughly 1 in 3 adults living with diabetes, and lower leg swelling is often one of the very first visible clues that kidney function may be starting to slip. A retired school teacher named Marjorie described it to me perfectly. She said her ankles had started looking like they'd swallowed a pair of tennis balls by dinner time most evenings, but she'd chalked it up to standing too much during the day, even well into retirement when she wasn't standing nearly as much as she used to. The advice here is straightforward. Elevate your feet for about 15 minutes a few times throughout the day, especially in the evening. Even a small pillow under your ankles can help fluid drain back toward the heart. And get in the habit of reading sodium content on packaged foods. Salt encourages your body to retain water, and most processed foods contain far more of it than people realize. By the way, if any of this is striking a chord with you, go ahead and hit subscribe right now so you don't miss what's still ahead today or what's coming next week. A quick like helps too. That's all I'll ask for right now. Let's keep going, because there's more worth knowing. Sign 7. Sharp, electric nighttime pain. This is the sign I see misdiagnosed more often than any other on this list. People come in and tell me, "Doc, I've been taking over-the-counter pain relievers for foot pain for months. I figured it was arthritis, or an old injury catching up with me." And sometimes that's exactly right, but sometimes the pain has nothing to do with arthritis at all. When nerves sustain damage from prolonged high blood sugar, they don't always go quiet. Sometimes they do the opposite. They become hyperactive, firing sudden, intense pain signals to the brain even when nothing is actually causing harm in that moment. Patients describe it as a stab, a hot needle, an electric jolt that comes out of nowhere, often worst at night when the body is still and there's nothing to distract from it. Reaching for over-the-counter pain relievers might mask this for a few hours, but it doesn't address damaged nerves, and relying on them daily over the long term carries its own risks worth being aware of, including potential effects on blood pressure and kidney function. That's a conversation worth having directly with your physician. Research into painful diabetic neuropathy suggests it affects a meaningful share of people living with diabetes. Commonly cited estimates put it around 1 in 4, and it's frequently mistaken for ordinary arthritis for years before anyone ever checks blood sugar as a possible underlying cause. I remember a retired mechanic named Bernard who'd lived with what he called the shocks in his feet for the better part of 3 years, treating it as old job-related wear and tear. It wasn't until a routine visit, almost as an aside, that the actual underlying cause came to light. If any of this sounds familiar, try this each morning before standing up. Spend 5 minutes doing gentle foot stretches while still in bed. Flex your feet up and down, circle your ankles slowly, gently pull your toes back toward you. The goal is simply to get circulation moving before you put weight on your feet for the day. Sign 8. Feet that stay cold. We all have feet that get cold sometimes. Cold tile floors, cold winter mornings. That's just life. What I want you to pay attention to is something more specific. Feet that are cold in the middle of July. Cold under 3 blankets. Cold while the rest of your body feels perfectly comfortable. That changes the picture considerably. Persistently cold feet that simply won't warm up are one of the clearer signs of peripheral artery disease, a condition where the blood vessels supplying the legs and feet have narrowed, often as a long-term consequence of elevated blood sugar. Warm blood from the heart simply isn't reaching the far ends of the feet in sufficient volume. Think of your circulation like the heating system in a large old house. When the pipes running to the farthest room narrow over time, that back bedroom radiator stays cold no matter how hard the furnace works at the source. Public health estimates suggest that several million Americans are living with peripheral artery disease, and diabetes is consistently identified as one of its single largest risk factors. Cold, pale feet are frequently one of its earliest noticeable signs. A retired church organist named Joyce told me she'd taken to wearing 2 pairs of socks to bed year-round, even in summer, just to feel comfortable. She'd mentioned it to her husband more than once, but never thought it was worth bringing up to a doctor. The single most useful thing you can do here is take a brisk 30-minute walk every day. Arm swinging, pace up, not a casual stroll. If 30 minutes feels like too much right away, start with 10 and build from there. The goal is to encourage blood to push further into the lower legs, which over time can help strengthen vessel walls and, in some cases, even modestly improve circulation. Sign 9. Hair loss on the lower legs, and finally, sign number 9. This is the one almost nobody brings up themselves. In all my years of practice, I've never once had a patient walk in and mention it on their own. It's almost always something noticed during a physical exam, after which the patient looks down and says, I never even noticed that." Take a look at the skin on your lower legs and the tops of your feet. Compare it to the hair on your thighs. Is the hair on your lower legs noticeably thinner or gone altogether? Hair follicles, small as they are, require a steady supply of blood and oxygen to keep functioning. When circulation to the lower legs has been gradually compromised over years of elevated blood sugar, those follicles slowly stop receiving what they need, and hair growth simply stops. The absence of hair on the lower legs becomes a quiet, visible marker of blood vessel changes that have been happening beneath the surface for a long time. Research into vascular health has identified a meaningful connection between reduced hair growth on the lower legs and peripheral circulation problems in people with diabetes. It's a sign that vascular specialists are specifically trained to look for during a physical exam, precisely because most people never think to mention it themselves. Right after this video, take a look at your own lower legs and feet. If the hair there is noticeably thinner or absent compared to the rest of your leg, consider scheduling a simple fasting glucose test sometime this week, not next month. It's an inexpensive test at most standard labs, and it's typically covered by Medicare. A small blood draw like that can meaningfully change the direction of your health going forward. So let's bring all 9 of these together. Tingling and numbness that comes without explanation. Burning at night in the soles of your feet. Cuts or wounds that take far too long to close. Skin discoloration on the lower legs and ankles. Heels that crack and split no matter how much lotion you use. Persistent swelling that leaves sock marks behind. Sharp, electric nighttime pain. Feet that stay cold no matter the season. And thinning or missing hair on the lower legs. Each one of these is your body's own early warning system, quietly asking for help, often years before any blood test would catch the underlying problem on its own. Here's what I'd encourage you to do tonight. Just one simple thing. Find a spot with good light, take off your socks, and really look at both feet for 30 seconds. Check between the toes. Look at the heels. Run a fingertip along the skin and notice whether you feel everything you should. Check the color of your ankles. If you recognize even one of the 9 signs we covered today, consider calling your doctor and asking about a fasting glucose test and an A1C test. Caught early, this kind of condition can often be managed far more completely, sometimes through changes in diet, daily movement, and an honest conversation with your physician, rather than more intensive treatment down the road. You've worked hard for the life you have. Your independence, your energy, your ability to keep doing the things and seeing the people you love. Don't let a manageable issue with blood sugar quietly take pieces of that away from you, simply because nobody ever told you what to look for. Now, you know. If anything in this video helped you today, I genuinely appreciate 2 small things from you. First, if you know someone over 50 or 60 who could use this information, a parent, a spouse, a neighbor, consider sharing this video with them directly. You might be handing them a piece of information they need but don't yet know they need. And second, if this is the kind of honest, practical health information you want more of, please take a moment to subscribe to this channel right now. I'm Dr. David Aid, and every week here, I share the same kind of straightforward health education I'd want for my own family. The things people often don't hear until they're already sitting in a doctor's office asking questions after the fact. Subscribing means you won't miss the next one, and it genuinely helps this channel reach more people who need exactly this kind of information. So if you haven't already, hit that subscribe button before you go. One more thing before you go, where are you watching from? Drop it in the comments below. I love seeing just how many different places this community reaches. Everything we covered today is general health education based on widely available medical knowledge. It is not a substitute for personalized medical advice. Every person's situation is different, so please talk with your own doctor before making changes to your diet, your medications, or your daily routine. Take care of those feet. I'll see you in the next video.